All right, next week you will be able to get a booster shot, a third shot if you've had the traditional 2 shots from some of the more popular players in this whole arena to get you vaccinated. But growing debate as to whether this Pfizer shot is necessary. There are reports right now that Moderna, with a lot of its data, is saying, given some of the spike in cases we've seen, including those among the already vaccinated, such booster shots might not be a bad idea. Now, keep in mind, Moderna is coming up with a booster shot of its own. Pfizer will have this shot available for use on Monday. So they might have a vested interest here. But Dr. Kevin Campbell is worried about something far greater than the booster shot debate, but what's happening as these COVID cases increase. The K-Rock Consulting President, CEO, and cardiologist kind enough to join us. Doctor, I want to show a map that illustrates probably your concern. This spread across the country where so many states intensive care units, in 6 states in particular, like Kentucky and Arkansas and Texas, Alabama, Georgia, are already over 90%, if not totally full. And a lot of that is because of COVID cases. So those with heart and other issues can't get to those ICUs. That's your biggest worry, right?
Absolutely. What we're seeing here in Florida in particular is our ICUs are overwhelmed with COVID patients who were not vaccinated. So I really think that, yes, considering a booster is very important, but I think our Biden administration would do a lot better job focusing on getting folks vaccinated in the first place. I think that if we continue to have lots of unvaccinated people, we're going to continue to see ICUs overrun with people who really shouldn't have to be there.
How serious? Normally, when you hear doctor, someone who's in intensive care, it's very, very serious. So are these cases among largely the unvaccinated who are in ICUs, are they in a dicey situation? Do they need to be in the ICU?
Absolutely. I know that lots of healthcare systems across the country are actually taking care of very sick patients on a floor bed or a step-down unit rather than the ICU because there's beds not available. When you go to the ICU, you need one-on-one nursing care. You often have multiple organ systems failing, and it is a big, big deal. Most of it is respiratory with COVID, and then you have other organ systems that fail right along. So it's a crisis.
You know what I'm also worried about, doctor, is that and this story earlier in the week of a heart patient who was desperately trying to get to a hospital. 37 hospitals reported there was no room in their ICUs. He later died. Now, a lot of people say, well, okay, those are kind of exception stories, but I'm worried that increasingly they might not be.
I think you're exactly right, Neil. I think they're not the exception. They're unfortunately becoming the norm. We're seeing a lot of patients put off, preventive care when it comes to their heart. We're having to put off elective procedures like elective cardiac catheterizations, elective pacemakers and ICD implantations. And, I'm afraid that patients won't go to the ER when they have chest pain because they're scared of COVID or the hospital's full. So I think we're in crisis mode all throughout the country.
Do we need booster shots?
It's controversial. I think that there are subgroups of people that absolutely need them. Those that are immunocompromised, those that have heart disease, lung disease, kidney disease, diabetes, chronic diseases, yes. Right now, we have observational data from Israel that suggests that immunity wanes and you probably should have a booster shot. However, The Lancet published a paper this week in the last 24 hours that contradicts that with other trials. So I think the jury's still out, and we need to look at the data more carefully.
Got it. Dr. Campbell, thank you. Always enjoy having you on.
Thanks so much for having me, Neil.